Hi, my name is Anu Subramanian. I'm a clinical educator at the University of Iowa, and this is the second in two videos about how to teach clinician-client alliance in SLP graduate education. The first module that I created is available on YouTube and focused on the importance of teaching clinician-client alliance in addition to technique in graduate education. We also talked about the definition of clinician-client alliance, being more than just the relationship, but also the agreement on goals of therapy and agreement on tasks of therapy. We also talked about two different ways, motivational interviewing and session outcome questionnaires, to develop the agreement on goals and tasks of therapy. In today's video, I'm going to focus mostly on the relationship or the bond between the client and the clinician as part of the clinician-client alliance. This is one of those things that's considered immutable, that someone has it or someone doesn't have it. It's a personality characteristics of being empathetic and being an active listener and being good at relationships, and someone who doesn't. While I think there's some people who are naturally good at this, this is something that can be developed, and it can be taught using some behaviors that we can help. We all have had clients that we haven't completely connected with, but we've sort of built that relationship with them, even when we don't feel an immediate connection with them. So there are ways to build a relationship, or we can teach a student to also build a relationship with the client using some evidence-based strategies. So one of the things that got me interested in the whole idea of clinician-client alliance and in speech-language pathology was this study by Plexico and her colleagues, where they asked a bunch of adults who stuttered to talk about what are effective and ineffective clinician behaviors that impact clinician-client alliance. So I pulled out the ones that are focused on relationship from their study, and it was things like genuine interest or client-centered or active listener, empathetic, creates a safe environment, building trust, having respect. Things that are behaviors that we can teach, things that are behaviors that we can learn that are not completely unchangeable. So keeping this in mind, let's think about, let me tell you about 4 ways that you can build clinician-client alliance and build relationships in clinician-client alliance in SLP graduate education. The first thing is using supervisory feedback. As clinical educators, this is the bare bones of what we do. We provide feedback, written or verbal, after most sessions, have meetings with students, discuss plans, and discuss what they're going to do in sessions. What Hoffman and his colleagues found in counseling education is that most of this is focused on building technique, as it should be, but we don't really provide much feedback regarding professionalism or the interaction because we think of it as unchangeable. But if we provided some feedback regarding this, then students can change that. So it doesn't have to be things like, you have to be a better person, you have to be a nicer person. But for adults sessions, it can be, where are you sitting? What's your demeanor like in terms of, do you have a paper in front of you that you're looking at, or are you looking at the client? What's your eye contact like? What are your nonverbal skills? Are your hands crossed? Are your legs crossed? What are your nonverbal skills saying to the client? With the kid, it can be, way to have more fun, provide more encouragement to the kid. It may be things like providing greater reinforcement, joining them in play, playing with what they're interested in, imitating their play, things like that, that build a relationship because you are working on some of those skills that we saw in the previous slide. So in addition to supervisory feedback, another way to build these skills is counseling classes. In the AUD program, these authors found that teaching students active listening, nonverbal communication, silence, and empathy were 4 micro skills that could be taught, role-played, and then students could do reflections and be evaluated on to build some of these counseling skills. David Luderman has a active listening activity in his textbook that also helps with active listening, nonverbal communication, silence, that help students develop these skills. Audrey Holland talks about positive psychology and client-centered therapy in her book. So using a counseling class or using counseling strategies in clinical education using role-playing can help students develop some of these relationship-building skills. Even if they have a natural affinity towards it, we can build these skills some more. In addition, the third idea is to use bibliotherapy or narrative medicine. This is something that I first read about Arnfeld doing and his colleagues doing in medicine in 2013. And this is where they read a book about a condition or a disability, discuss and or reflect on it, and then help them make cognitive shifts about the lived-in condition about a disability or a condition. So a memoir is a good way to do this. And we all probably have done this in our own clinical education or clinical practice, where we have students read books about a condition or a disability and talk about it. So what Arnfeld and his colleagues found was that it increased empathy, it increased communication, it helped the students learn to be more patient-centered following a course in narrative medicine. A colleague, Hope Gerlach, and I did this with adults who stutter and graduate students, where they all read the book Out With It, which is about stuttering, a memoir on stuttering, and discussed it in sessions, reflected on it separately. What we found is that students were able to better empathize, had deeper respect and understanding, and were able to create a safer environment. If you remember from the first slide, these are some things that we talked about as being important relationship builders for in clinician-client alliance. So things like having a safe environment was one of those things that we talked about. Empathy was another thing that was discussed. This can be done in clinical education, where as a supervisor, you have a student read a book and discuss it with you. You can also create a class around it. Linda Luco, who was the clinical director at Iowa a few years ago, started a class where the students read the book Far From the Tree by Andrew Solomon, read chapters like deafness and autism and Down syndrome or transgender, and discussed it as a class. And we still have that class where students are also able to talk about understand their own biases, understand their own prejudices, understand their own stories coming into a relationship, and make these cognitive shifts about how to connect with the client. So that also helps build relationship. As part of the class, we also have students write parallel charts. This is something that Rita Sharon discusses as being an important way to build empathetic competence. So when a student goes in and sees a client with aphasia, for example, there's a lesson plan, there's goals, there's data, there's SOAPs, but this client also reminds them of their grandfather who had a stroke. So how does that come into play? Do they push the client a little bit harder because they remind them of their grandfather and they want their grandfather to make progress? Or did they hold back a little bit because it reminded them so much of their grandfather that they were unable to work clinically with this person? So where do you write that and where do you process that? That's the parallel charts. And she talks about how this is not a diary or a letter to your sister, but written in the service of the client. So where you as a clinician start understanding your own past history, understanding how that's impacting your relationship with the client in the service of the client. So those are 4 different ways that we talked about today to build clinician-client alliance and relationship in clinician-client alliance. So using feedback in clinical education, providing counseling, role-play counseling opportunities either in class or in clinic, bibliotherapy or narrative medicine, and parallel charts. These all can be done in a classroom setting or in a clinical education setting. And they all go back to helping students develop these skills that look like their personality skills, but there are more behaviors that can be taught, like empathy or active listening, nonverbal communication, open communication, supportive, provides encouragement, things like that. These from the study where clients have said that this is what helps build an effective alliance between a clinician and a client. As you can tell, this is something that I'm really passionate about, both clinician-client alliance and clinical education, or most anything related to clinical education. So if you'd like to talk to me some more about this, get some references, get some more ideas of things that you can do in your program, feel free to contact me in any of these ways, and I look forward to hearing from you. Thanks.